We are following the latest on the pandemic, and here are the facts at this hour. The U.S. has surpassed 11 million coronavirus cases. 1 million of those cases were reported in the past week alone. Sweden unveiled new regulations of its own today. The country's strictest to date. Public gatherings of more than 8 people will be banned as of next week. The Prime Minister urged Swedes to cancel plans and stay home. The country has drawn attention for its softer approach in dealing with the virus. And British Prime Minister Boris Johnson is self-isolating after coming into contact with someone who tested positive for the virus. Johnson was hospitalized for COVID-19 back in April. His spokesman said he is well and does not have any symptoms as of late. And United Airlines will deploy its first COVID-free flight from Newark to London today. Passengers will take a rapid test near their departure gate and receive their results before the plane takes off. Those who do, in fact, test positive will be isolated and barred from boarding the flight. The trial flight is scheduled to last 4 weeks. All right, as coronavirus cases surge across the country, Iowa's healthcare workers are being pushed to the brink. Iowa is setting daily records for people hospitalized with COVID-19. In an interview with ProPublica, the Associate Chief Medical Officer at the University of Iowa Hospitals and Clinics said this: people in leadership are starting to say things in meetings like, "I have a sense of impending doom." Joining me now is Suresh Gunasekaran. He is the Chief Executive Officer of the University of Iowa Hospitals and Clinics. Suresh, thank you so much for joining us on this. We really appreciate it, and we understand there are some dire circumstances happening in your hospitals and in your state, so we appreciate you taking the time out to talk to us. I want to read from a piece in The Atlantic that quotes a nurse and an infectious disease doctor that practice in Iowa. And the nurse says this: "It was doable over the summer, but now it is just too much." She was also asked about how much slack the system has left, and she said, "There is none." Then the infectious disease doctor said, "The wave hasn't even crashed down on us yet." He goes on, "It keeps rising and rising, and we're all running on fear. The healthcare system in Iowa is going to collapse, no question." Suresh, give me your reaction to what I just read of those nurses and doctors, and what exactly is happening on the ground there from your experience so far.
Sure, it's great to be with you. I think these comments are really reflective of the strain and stress that healthcare workers are feeling today in Iowa and across the country. This has been a very long pandemic, and right now what we're experiencing in terms of infection rates, hospitalization rates, are the highest that they've ever been. But fundamentally, I will say that we aren't out of beds. At the University of Iowa Hospitals and Clinics, we have additional capacity to continue to see patients. We are taking transfers, as we always do, from across the country. And we've already started making preparations to make more ICU beds available and have additional capacity available to support Iowans. But what you're hearing from the front lines is the implication of what happens if these numbers continue like this for the next few weeks or months. What I'm worried about is not necessarily today. Today, you can come to the University of Iowa Hospitals and Clinics and still get the same level of care you would have gotten a month ago or a year ago. But really what we have to ask ourselves is, if we don't make some changes, where will we be in a month or in a year? Talk to a lot of colleagues who are CEOs of hospitals around the state, and they're not as lucky as us. They don't have the ability to expand capacity or have the extra staff that we have at the University of Iowa Hospitals. So what we have to ask ourselves is that this entire system is under stress, and how long can the system hold up? Because individual hospitals are facing this very real crisis every single.
Another question to ask is, are they believing the lie? Is a question. Do they believe that there is COVID-19 and that it's real? Or are they listening to the lies? All right, that's the question. How many people who have contracted COVID-19 in Iowa believe that it was a lie? These things need to be investigated, and then they need to help show these people to other people, let them speak out and say, listen, it's real, and it's actually affecting lives and destroying lives. Christ says that I'm come that they might have life and have it more abundantly. Christ wants the abundant life, the good life, the full life, a healthy life. And so that's what we should be seeking and helping to materialize in the here and now, helping everyone to live healthily in good health, in peace, in community.
Day.
Look, you talk about it. We saw it here in New York, right? It went from 0 to 60 here in New York. At one point, we weren't at capacity in the city, and then we were at capacity. And healthcare workers were pleading for help. How are you preparing? How are you getting ready for when your hospitals in your state hit that capacity and you begin running out of beds?
You brought up a really good analogy, and what we have is some time on our hands to have learned from the experience of New York and other places. For weeks, we have been planning for additional ICU capacity. So we've added 15 beds as of today, and we'll add another 15 over the next week. We will continue to bring in staff from other functions to help fortify the existing staff that we have here today. We reduced the number of surgeries, elective surgeries that we were doing beginning last week, in order to create enough capacity, both in terms of beds and staff. But ultimately, there's only so much we can do. But right now, we really have expanded what we're able to do here in Iowa City.
All right, Suresh Gunasekaran, thank you so much for your time on this. Really appreciate it, sir, and good luck to you in the days and months ahead. All right, Democratic leaders are calling for a sweeping stimulus bill to match the rising threat of COVID-19, but will they find support on the other side? That is the big question. We'll be right back.
And that should be one of the questions that's raised in the Georgia United States Senate elections, the two senators there. Where does everyone stand? Of course, the Democrats stand on what? Absolutely, a stimulus package for the middle class and lower classes, right? For everybody, okay? Wall Street has their money already. Now it's time for Main Street, okay? And make that an issue, a national issue. And that will help to bring out more voters on the Democratic side in Georgia. Thank you for being on my YouTube page.